Hello, the following is a demonstration of how to set up enteral feeding via a continuous drip or feeding pump. We will begin by first checking our MD orders, and next we will gather the appropriate supplies. The supplies we will need for this procedure include, first of all, our feeding pump, formula, a feeding bag and tubing, a 30 milliliter or larger syringe, a stethoscope, and pH testing strips. We also want to verify that our current setup is no older than 24 hours. Now Kelly here is going to begin by entering the room and performing hand hygiene like a good nurse.
Hello, Mr. Smith. My name is Kelly. I'll be performing your enteral feeding today for your nasogastric tube. Can I check your wristband for your name and birth? Can you state your name?
John Smith,
And your date of birth?
December 25th, 1929. She's going to then bring the bed up to a comfortable working level. She's also going to raise the patient's head of bed because for this procedure, it's going to need to be at a 30 to 45 degree angle. Now we're going to get ready by taking our formula. We're also going to verify that it's been at room temperature. Okay. Next, we're going to fill up the bag and prime the tubing. This tubing has a roller clamp on it, which should be in the off position. We're going to fill the bag with the formula and then open up that roller clamp to prime that whole tube. And when it reaches the end, we can close that roller clamp. Next, we're going to verify the placement of our NG tube. We're going to do this by drawing up first 30 milliliters of air to inject into the tube. While she does this, Kelly's going to auscultate for an audible pop, which will tell us that we're in the right place. All right, we hear some noises, so we're in the right place. Next, we can aspirate some contents. We're going to double check using our pH testing strip. Okay, that's good. Now we can put those gastric contents back, and then we're going to drop 30 milliliters of water to irrigate that line with. Now we're ready to hook up our tubing here. So we're going to take that distal end, hook it up to the NG tube via that Lopez valve, still in the off position. Then we're going to thread the tubing through the pump. Okay, we're going to double check that we're still hooked up to the patient. Probably open up that valve at this point. Then we're going to turn on the pump and set our rate. In this case, it's going to be for 50 milliliters an hour. We can now just roll up that roller clamp. We can hit start. We also want to make sure that we date our bag for the time of the feeding. Now this bag can stay up for 24 to 48 hours since it is a closed system. If it were an open system, it would have to be changed every 24 hours. Kelly is ready to leave our patient in a safe and comfortable position. Give the patient that call light. Remove her gloves and perform hand hygiene. Great job. And our last step is to document our procedure.